Hi, everyone. Thank you so much for joining us today. We'll begin the program shortly in just a few minutes as people continue to enter the webinar. Good morning, good afternoon, and good evening. Thank you so much for joining us today for the Harvard Humanitarian Initiative Careers in Humanitarianism webinar for the month of April. We're thrilled to have you with us today, and we have a great faculty member and researcher from HHI who is going to tell you more about her career in the humanitarian field. Before we begin, I'm going to tell you a little bit more about the logistics of the event today. We'll be here for about an hour. The first half will be dedicated to our panelists describing her career path, and the second half of the event will be for an audience Q&A session. I'd like all of our attendees to submit questions through the Q&A button found at the bottom of your Zoom screen. Simply click that button and submit your questions via the text. We'll do our best to get through as many questions as possible. So without further ado, I'd like to introduce our panelists today. Dr. Erica Nelson is the co-director of the Humanitarian Geoanalytics program and the Signal program at HHI. She is also an emergency medicine physician at Brigham and Women's Hospital and instructor at Harvard Medical School. Dr. Nelson recently returned from her deployment to Ukraine in her role as Deputy Medical Director at Team Rubicon, and Erica's research focuses on the use of geospatial methods for public health and humanitarian response. Dr. Nelson, thank you so much for being with us today, and I will pass it off to you.
Thank you so much, Sabrina. I am going to go back and share my slides with everybody. So first order of business, hello, thank you so much for joining us today. I am deeply honored to be able to speak to you all with regards to my career in humanitarianism. My name again is Erica Nelson. I go by she, her, hers, and my Twitter handle is there. Of course, you can contact me at HHI or through Twitter, and hopefully I'll get back to you as soon as possible. But I'm looking forward to fielding all of your questions later during this webinar. So first order of business, who am I? I am many things. I am an emergency medicine doctor, as Sabrina mentioned. I work at the Brigham and at the Faulkner as a nocturnist in the emergency department. I am also research faculty within the Division of Global Emergency Services and Humanitarian Research, and at HHI under the auspices of Harvard and Harvard Medical School. And then my most recent development is that I am a Deputy Medical Director for Team Rubicon, and I'll talk about that a little bit later. One of the things that brings me here today is my deep love of humanitarian geoanalytics. And so I'll spend the beginning part of this conversation talking about my role with the Harvard Humanitarian Geoanalytics program, which I have lovingly come to call HumGeo. So HumGeo is a research program at HHI that looks to bring the power of maps and math to improve humanitarian research and programming. Humanitarian geoanalytics is a field that touches many different things. It's a methodology that recognizes how stochastic the humanitarian space is. So we seek to bring together multiple different disciplines, multiple different conceptual lenses and methodologies and data to really think about the humanitarian space. So this means bringing together everything from climatological sciences, behavioral sciences, conflict studies, gender studies, public health, medicine, to really think about the populations that are affected by humanitarian crises. Oftentimes, this means bringing in methodologies from optimization research, from remote sensing, predictive analytics, to be able to comment upon research, programmatic design, to be able to put together pieces for advocacy and policy, and also to bring together some educational products. This is directly from our website. So HumGeo itself hopes to leverage spatial analysis as a methodology that goes beyond mapping that you're familiar with to use inferential statistical methods to do three different things. We want to create new answers through the use of spatial thinking, because we as humans all have the intrinsic ability to understand where we are in time and space, and then to build a new academic base for humanitarian research and response. Ideally, and most importantly, our goal is to optimize the impact of humanitarian research and programming through spatially explicit understanding of needs and resource deployment. Again, we have three different mechanisms of action. We do research and we try to build a research foundation and an evidence base for humanitarian understanding and for response. We create and deploy educational resources. And then we also work as a consultancy option for organizations, NGOs that don't necessarily have GIS capacity in-house. We engage with many different components of the humanitarian landscape. Humanitarian Geoanalytics is a methodology that can bring together so many different pieces, so many different variables that are critical in understanding in the humanitarian space. And so therefore we have a very broad portfolio. In the past and currently, we've looked at the environmental impact of refugee influx on the area around Kutupalong in Bangladesh. We've looked at the intersection between migration and climate in the East and Horn of Africa. We've looked at gender-based vulnerability in Rohingya women and girls. We've also done work on EMS in the Navajo Nation here at home. We've engaged in conversations around how do we strengthen humanitarian health systems or atrocity, early warning and early action systems, leveraging spatial analytics and spatial platforms. We've looked at the use of drones, also known as UAVs, in humanitarian response. And we've looked at kind of a various number of different health or health-oriented programming throughout the humanitarian landscape. Through my research with HHI and even before, we've worked with a numerous number of partners all across the world, because as my colleagues and myself believe, it is beholden upon us to work with programmatic folk as well as academic folk in order to create the most impactful, ethical, equitable, and sustainable programming and insights. So here is kind of a smattering, because I am a lover of maps. Here is a smattering of the places that we've engaged with, multiple places across Africa, Nepal, India, China, Tibet. In this little tiny area here, lots of work in and around Palestine and of course, Ukraine. And I've noticed that there is a dearth of programming and response that I personally have engaged with in the Central and South American regions, something that I'm hoping to rectify in the near future. Now, I'm going to transition very briefly to something completely different. I'm going to talk about a little bit my time with Team Rubicon. Now, for those who don't know, Team Rubicon is a disaster and humanitarian response organization on the international front, which is what I'm predominantly working with. We are an emergency medical response team that is verified by the WHO as an EMT type 1 mobile, which means we have the capacity to go in and be self-sustainable and move from site to site, providing medical care where it is most needed. So as I mentioned, we are an EMT type 1 mobile. We also engage in medical human resources augmentation. That's a fancy way of saying, as we engage with our partners on the ground, we help identify gaps in their human resources and help fill in. So let's say, for example, in Haiti, the emergency department down there required some assistance from a medical standpoint. So we provided nurses and doctors and paramedics to go help. We also engage more and more in capacity exchange and disaster risk reduction. So increasing trainings, thinking about system support, how do we engage and improve or augment, let's say, for example, medevac systems within Ukraine in order to help kind of move patients from the east of Ukraine into the west of Ukraine where there are more resources, or even out into Poland. Now, my work with TR is actually relatively new. I started in December of last year, and these are some of the places that I have already been a part of our programming. So here in the United States, looking at our COVID response within the Navajo Nation and with the IHS, down in in Central America, where we are working on some DRR projects, doing trainings and also helping do primary healthcare in more rural communities. Down in Central Africa, where we're helping build up their national emergency medical response teams. Also similarly in Haiti, looking at how to help build out their disaster response teams and their capacity. Looking at kind of the cyclone response down here in Madagascar earlier in the year. And of course, here in Ukraine, where we're doing a lot of different things, everything from primary healthcare, really direct patient care for IDPs and refugees in the region, to building out some of those systems to help transport critical patients from the east to the west and out to Poland. We're also deeply engaged in a lot of trainings around point of care ultrasound, field blood transfusions, and even CBURN trainings, so chemical, radiological, biological, nuclear, and explosion trainings throughout the region. How I got here, I know this slide is horrific, and honestly, I did not fight too hard to make it more manageable or more pretty, because my path here has been very circuitous. Back in 2004, I graduated from the University of Puget Sound out in Tacoma, Washington, beautiful place, with a bachelor's in molecular biology and comparative religious philosophy and theater. People are going to call me out on that. Feel free in the future. And from there, I really learned kind of to get into the humanitarian space. I started off as a field medic and a humanitarian aid worker, and did that kind of going from contract to contract over time. In that context, I learned some very hard lessons. I learned that medicine cannot operate in complex humanitarian crises without truly understanding that context, and that a medicine-centric response can often undermine the health of the population and can oftentimes contribute to the conflict or even put populations at risk. And so from those very difficult lessons that we all learn as young humanitarians, I decided to kind of create more understanding from my standpoint. And I went into an international peace studies and development program at Trinity College Dublin, where I looked at the contextualization of health-oriented programming in conflict-affected communities. A little bit before that, and reaching forward, I became a researcher and programmatic and policy consultant for many different organizations throughout the humanitarian landscape, everybody from the International Rescue Committee to the UNHCR, the IOM, et cetera, and continue to do research and programmatic kind of consultation on how best to deploy or design and then deploy humanitarian response. During my time at Trinity College Dublin, I started to come into the world of spatial analytics and GIS, and hence that's when my time as a GIS nerd initiated, because as I discussed earlier, time and space is what brings everything together. And so being able to understand what are the tools that we have in order to bring together kind of this stochastic space, GIS became a really strong focal point for me as a methodology. In 2013, I went on to get my medical degree at the University of Washington. And in 2013, I got my degree at the University of Washington as a doctor. And then I went on to be part of the Harvard affiliated emergency medicine residency here in Boston. During that time, I continued my research, I continued my work as a GIS nerd, and I continued to build my love as a clinician. In 2019, I actually got my master's degree in the use of GIS for public health, something that really allowed me to shore up some of the basics, some of the theory, and really dig into the nitty-gritty of the use of GIS for population studies and spatial epidemiology. From there, I went on to become research faculty at HHI, and along with my compatriot and somebody else who's drank the GIS Kool-Aid, we founded the Humanitarian Geoanalytics program, which we continue to engage with to date. And all the way at the end here, as I mentioned, just a few months ago, I became the Deputy Medical Director of Team Rubicon. And so I continue to engage in 3 different professional spaces as a doctor, as a research faculty, and as the Deputy Medical Director. And I'm deeply, deeply blessed to do all of these different things because it lends a certain amount of nuance and kind of cross-disciplinary understanding to each of the other components. And I'm deeply honored to continue to do all of those things. So with that, I kind of think about how I got here, and I think about what are the recommendations I have for people who are trying to come into a humanitarian space. Now, these are incredibly broad statements regarding my recommendations, but really finding what you love is incredibly exigent when you're thinking about how you want to enter the space. Now, sometimes you need to be opportunistic and try to figure out how the opportunities presented to you interdigitate with what you love. But at the end of the day, it's really important to come back to the thing that brings you joy and the thing that kind of revs you up and keeps you moving forward. Finding your compatriots is critical. These are the people who are going to be your mentors, your sponsors, your partners, your research colleagues, and finding those people who really love what you love and or complement your skills is really important to moving forward. Building out your skills. Over time, you're going to get excited about so many different things. You're going to notice the gaps in the work that you can do. And I am an eternal student. And I've promised my friends and colleagues that I will not go out and get a PhD right yet, but it's coming because I keep on recognizing these skills that I want to have, that I want to be able to evolve, and that I want to be able to contribute to my work. Taking a quick beat, I think it's really important for us to understand current and past power structures and the ethics and equity that we need to be working towards as researchers and as humanitarians and people who are in positions of privilege. I know that we have all benefited off of these structures of power and privilege, and as long as we continue to think about them, be cognizant about them, and try to actively engage in bringing equity to ourselves and our colleagues, I think that is incredibly critical. Be patient and yet tenacious. As you've seen, my personal trajectory has not been linear. And part of that has become because I come from a lower socioeconomic background, one in which there were no doctors, there were no faculty members at big fancy institutions. And so even though I showed you that relatively linear course of undergraduate to graduate to medical student, I also worked 20 years in the service industry in order to support a lot of that. And yet I kept what I loved at heart, and I kept moving forward. And lastly, and why the beautiful rainbow of socks is relevant, the idea of changing your socks is actually critical. And what do I mean by that? I mean taking a beat and taking care of yourself, recognizing when you're overwrought, overdrafted, underslept, because unless you take care of yourself, unless you change out your socks, you won't be able to operate at your best. And at some point you're going to burn out, and you're not going to be able to do the things that you love in the ways that you want to do them. So those are my general recommendations. That's my general life, my general course, and my 30-minute elevator pitch. Lastly, and I would be bereft, and I know Tanya would be, or excuse me, not Tanya, my great colleague Syra would be bereft if I did not mention that at HumGeo and at the Signal program, we're currently looking for a graduate student intern to help with our atrocity early warning, early action project. This would be working with us to go through our literature review and to help with qualitative analysis, looking at stakeholders who engage with early warning, early atrocity programming, and trying to figure out how best to build spatial products for them to be able to create better programming. So I believe Sabrina has dropped that link in the chat, or you can reach out to me or Syra in order to ask about this position. But we're looking for graduate students. Our team is growing, and we're really excited to include more people. So with that, I'm going to end my chat. We've got quite a lot of time. I've got quite a lot of things that we can talk about. So let's just start with questions.
Great, thank you so much, Dr. Nelson, for your presentation. I really like the sock metaphor, but great. So to start things off, I guess, you know, my initial question is, what excites you most about your work?
Oh gosh, so many things. Let's see. So my route has been circuitous because there are many different pieces of my brain that need to be engaged, right? So my nerdy brain that gets really excited about critical cartography and theory and geostatistics, like that piece of it really comes into play when I'm thinking about HumGeo and I'm thinking through those projects. My need for something to be really tangible and impactful comes through when I'm thinking about Team Rubicon and being a doctor. And then lastly, like scoping back out again, this idea that we are bringing together communities in order to make a bigger impact, in order to make something that's evidence-based and equitable and sustainable. Like those three things together have really driven me forward in kind of creating this, I don't know, like prism of work that I'm doing.
Great. And so we're getting a lot of questions about self-care. And so how do you cope and handle with the stress in your job, especially when working internationally?
So lots of different things. I think I have built out in my life some mindfulness practices, something that has really allowed me to become a doctor and a humanitarian, something that demands that I be present when I am engaging with people and patients. And when you're deeply present with somebody, like that's where you engage with a human. And I recommend that whether it be mindfulness or it be some other mechanism, people really start drawing boundaries around things so they can deeply engage. And sometimes that means like, if I'm off, if I'm taking some time for myself and I'm reading a book or I'm making dinner, my job is to forgive myself that time and to really be present with the food that I'm making or the people that I'm with, and not be worrying about the fact that I am, you know, not responding to an email or not writing a manuscript, right? So self-care is just as much about being present as work is. I am horrible at having real sleep schedules, but because I'm a nocturnist and I have a job during the day, right? And so people are like, when do you sleep? And really not as well or as often as I should, but knowing those moments in my life where I can really block off some time is important as well. So lots of different things there, but that's the crux of it.
Great. So another viewer was wondering how you got into your work with Team Rubicon, what brought you to them versus other organizations, other international organizations like MSF or ICRC?
Yeah, so I've worked with lots of other organizations. I've worked with MSF in the past, ICRC, UNHCR, lots of different organizations. Team Rubicon is an interesting beast in that it started back in response to the earthquake in Haiti. It got some interesting flack for not necessarily operating with the known humanitarian best practices, and it kind of took a moment and a beat and refocused on its domestic work. And over the last several years, it's really started to think about how to re-engage in an ethical way within the humanitarian space. And that's one of the reasons why it became verified as an EMT type 1. Right? Because it's working with an international body, creating standards, and really thinking about the best way to work within international populations in crisis. So that in of itself is a very interesting story, right? It's relatively new in this like line of effort. It's kind of changing up and really interested in thinking through what are its next steps. What is its MO? What are its ethical, what's its ethical compass, if you will? And that in and of itself made it really intriguing to me, because it's taking this like self-reflective kind of evolutionary standpoint. The way that I got involved in it is that I actually had a colleague come to me and say, hey, these folks are looking for a deputy medical director. Are you interested? Because I have this background in humanitarian response, because I have kind of an academic bend, and I also have a lot of different perspectives on how best to engage. And it took me some time to actually make the decision. It took me, I would say, I started off the conversation in August with the medical director. I had a conversation with him. I had a conversation with the director of ops, multiple interviews, and lots of self-reflective periods. Like, is this the organization I want to engage with? Does this make sense for my career? How do I balance this and my academic career and all of the demands that are around that? And at the end of the day, I realized it added one more piece to the puzzle to me, right? Like, it had this really interesting, insightful way of going about like growing their programming, but it also had this really tangible piece of actually implementing humanitarian programming that I didn't get from my work at HHI. Because my work at HHI is so much more cerebral, so much more research oriented, and it's not boots on the ground. This is how we do it. This is how we reflect. And so I went down there for one of their disaster simulations early in December, and was deeply excited about the passions of these folk that I'm working with, about their political alignments, about their ability to engage in kind of a more sophisticated, nuanced way. And that just solidified the entire thing for me. It was like, yes, I love this space. I love these people. I love the way that they're thinking about kind of changing up how they're doing. And I also am super excited about the fact that I have something to lend to them. So, long answer to a short question.
No, that was perfect. So we're getting a lot of questions about GIS and developing those skills. So do you have any recommendations for people who are interested in GIS and want to develop more of their background in it, experience? Any course recommendations?
Well, let's see, there's so many different ways. So I started off GIS as kind of a do-it-yourselfer way back in the day. I picked up QGIS and I picked up R, and I searched the internet and I asked people like how to go through things, very piecemeal. So probably the opposite of what most people do. A lot of people will go in and say, I'm interested in GIS, and will go and get their master's degree and move forward in like the normative way, which is perfectly acceptable and probably the right way to do it. But some of us don't have that capacity. And so there are lots of ways to start with GIS. If it's just coming to our webinars, going online, seeing what is available, there are lots of resources through Esri. So not to put in a plug, but they have really good tutorials online to think about, like, how do I go about doing something like a cluster analysis? Like, what is the right way to look at this kind of data? How do I start thinking about it? Obviously, you can come to myself, come to my colleagues, and sit down and have a conversation around what is GIS and how does it make sense for my work. There are lots of different entry points into it. I mean, the first is to start understanding why it's important. And the next is to start understanding what are its potentials and its limitations, right? There are great classes at CGA, so the Center for Geographic Analysis at Harvard. There are classes through the School of Public Health. There are lots of different spaces. I'm not sure how many people here are involved in the HUSER, or the Humanitarian, help me, Sabrina, the Humanitarian
Intensive responsive course.
Sure, yes. There's the Humanitarian intensive course here at Harvard. There is also the GHP Humanitarian concentration. So I give lectures in that. My colleague Greg and Cyro both give lectures in that. there are lots of little spaces in which we try to inject GIS into everybody's learning, because we're here to create an army of people who know how to do this, or at least understand the value of it. So there's lots of spaces, both within Harvard, outside of Harvard, in which to engage this, and then just little tiny kind of piecemeal things offline that I can always recommend. We did a small webinar series 2 years ago around the use of spatial methods for humanitarian response that is available on YouTube, that kind of gives you a little bit more insight into critical cartography, into remote sensing, and into spatial analytics. So there are lots of ways in which you can get involved.
Great, and I put in the chat some of the educational offerings that HHI has.
Thank
So
you.
the next question is, what is the most memorable lesson learned in your humanitarian aid response career?
Oof. There are many. I would start off with the one that I mentioned previously, in that, so a long time ago, when I was a wee international medic, I worked in Nepal during the Maoist revolution, during the Nepali Civil War. And I went in with like bright eyes and lots of fervor, completely aware that I was entering like a war zone, but I didn't, and also having this very optimistic view of physicians, clinicians, and people who operated in the medical space. And the unfortunate reality is that people are still political beings, and sometimes the folks that you work with will let those leanings get in the way of their Hippocratic oath or their quote unquote neutrality. And, being a field medic working at the behest of physicians, certain people were denied care. And they were denied care because they were part of what was considered to be the opposite side of the conflict. And as, a wee optimistic, idealistic human, that was really hard to watch, because I was like, this person is outside of the clinic, we have to take care of them. And they're like, we're not letting them in. They can go somewhere else, or they can die outside. That's just horrifying. And it continues to happen throughout the world. And, of course, we continue to espouse the humanitarian principles of impartiality and neutrality, amongst others. But the complicating factors is that's not always the way either our colleagues work or the universe works, and we have to appreciate the nuance of that, and we have to respect other people's perspectives and why they engage with the world in that way. We see it in the emergency department. Everybody comes in with different perspectives. We see it in the United States. Everybody chooses whether or not to engage with COVID based upon public health guidelines or not, right? It's tricky, and it's really important to be able to, if not agree with, then understand and empathize with where people are coming from. Sabrina, I think you're on mute, dear.
Great, thank you so much. So we have a couple of questions from mid-level professionals who are focused not in the humanitarian field, whether they're in law or banking, finance, but they do have an interest in pivoting their career to humanitarian response and medicine. Do you have any advice for these individuals?
Ooh, okay, let's see. So as I said, like, the humanitarian space is very stochastic, right? So law and finance, like all of these things kind of come together with multiple other pieces of the cluster system. So I think if you're hoping to pivot your career towards humanitarian aid and or towards humanitarian health, there was a lot of indigitation there. So we're thinking about, like, how do we finance humanitarian healthcare systems? Like, what does anticipatory financing look like within that space? And so lending your specific career skills to those questions will help kind of open the door and show you kind of what the beast looks like, but will also prove your value in that space, and you'll be able to kind of grow upon that and transition more easily, right? Like law is exactly the same way. There's a bunch of IHL out there that has to do with healthcare. There's a bunch of other kind of international law components to humanitarian aid and humanitarian health that you can leverage your own skills in order to get in the door. When it comes to a full like pivot, if you want to say, hi, I'm a CPA, or hi, I'm a blah, I want to become a doctor, or I want to become a physician, like a physician assistant, something else along those lines, of course, that's going to require like a whole new line of education. But I always recommend people, if they want to kind of start to put their fingers into other spaces, to start exploring what that actually looks like, and start exploring their colleagues, their like what are the opportunities out there? What does it actually look like, before falling full force into, let's say, 8 years of education? So I hope that answers that question.
Great. And then we do have a lot of questions about graduate school. Do you recommend that students work in the field for a few years before entering graduate school? Is graduate school the best route for a career in humanitarianism?
So the thing about humanitarianism is that it is not a kind of one size fits all space, right? I always recommend that you have some version of field experience. I think that grounds any sort of theoretical or research oriented work that you're going to do. I think that it is always hard to get into like the on the ground spaces, kind of as you get later on in your career. A lot of these organizations are asking for you to dedicate time in order to build up your resume so that you can kind of become like that higher level up. So if you exit grad school and you've never had boots on the ground, it's going to be really hard to get into a WHO position or a UN position or some of these other spaces, because they expect you to have that knowledge to be able to prove yourself kind of in that environment, because the theater is a different beast altogether. It requires a different cognitive load, and it requires kind of a different personality, and a different set of skills. So depending upon whether you go straight through, right, undergrad, grad school to whatever, or you leave gaps in between, like I honestly think that you're going to need some version of on the ground experience before you kind of reach these higher echelons of professionalism. I am a person, and this is my perspective and not necessarily the right one. If you have the ability to take a beat in between undergrad school and grad school and go do something that is not education, you do it. You might not have the capacity to do that, and I respect that, that's fine. But whether it's, working here in the United States in an internship, working internationally in a safe space with an established organization that knows how to get you out of Dodge if in case you need to be. That was one of the other fun experiences I learned. I highly recommend it because it distills your perspective. It really informs your value system and your priorities. I learned what I loved on the ground, right? It was a crystallizing moment for me, and I would not have been able to do that in a classroom somewhere. So if you have the capacity to do that, I would recommend it. But again, this is my personal journey and not something that I need to bring down upon others.
Yeah, no, it looks like in the chat there are a lot of people who are interested in engaging in field work and connecting with humanitarian organizations in the field. So do you have any advice on how people should go about connecting and engaging with these organizations to gain field experience?
Yeah, that's also tricky, right? Because there are lots of people out there who come out, bright-eyed and bushy-tailed and want to go into the field. And so a couple of things, like number one, I am deeply against humanitarian tourism or disaster tourism. I think that, just because it's shiny and romantic doesn't mean that you are fit for it or the organization has the capacity to support you. And more importantly, your presence doesn't always mean a positive impact to the populations we're trying to serve, right? Sometimes it's the opposite. Sometimes our presence is exploitative, and we have to be very cognizant of that. So while I deeply, deeply support people going to work on the ground, doing your research first is really important. And it's also beholden upon the organization that is sponsoring people or that is putting people out into the field to do it correctly. We're all still learning in the humanitarian space. But so all of that being said, it's about connections, it's about tenacity, it's about availability, and it's about proving that you have value in that space, right? So if you're a field medic, then apply to MSF, IMC, Team Rubicon through their portals, have long conversations about what your work there would look like. If you are somebody who's interested in refugee resettlement, like I had an internship with the International Rescue Committee out in Seattle, and I was just in the office being their intern, working my butt off for free. And that really gave me some insight, really a lot of connections. And again, I didn't have the privilege to work for free for, sustenance. So I actually left that job, changed, and went and worked in the service industry during the evenings in order to support that. So again, it's not a perfect system, but I would look at the organizations that you're interested in engaging with, go to their websites, email people, sign up for their listservs. If they have registries for, possible deployments, sign up there. Continue to reach out to the professionals around you. And like I said, be very tenacious, but be patient and understand that not every opportunity is the right opportunity, right? I want to make sure that people get out there safely, but they're also producing good as opposed to the opposite.
Great. So we have another attendee who is wondering if you plan on using your GIS expertise to inform Team Rubicon's work in Ukraine, and if so, how?
Yes. Oh my goodness. Okay. So nothing is official. Nothing is official. But one of the things that I'm really excited about is the idea of utilizing GIS to be able to identify hotspots of need and juxtapose those with resources that are already on the ground. One of the things that we're thinking about is how do we utilize GIS in order to improve medevac systems, right? Like I said, nothing is finalized. This is just a conversation. But in my head, as I was on the ground thinking about what are the options, right? Okay, how do we identify who are the patients that need to be transported out? What are their needs? What is their location? What is the exigency of transport? And then thinking on the other side of things, like what are the resources? Where are the hospitals? What are their current capacities? Do they have the ability to do orthopedic care, chemotherapy? Like what is their ICU capacity right now? What is their bed capacity right now? Given the number of clinicians that are overburdened, like how many people can they actually accept? And then doing the intermediate kind of environmental stuff, like what is our capacity for transport? Where are the ambulances? What are those ambulances' abilities? Are they ACLS, BLS, PEDS, critical care? And then what are the lines of conflict? What do the roads look like? What is the infrastructure? And putting all of that into a GIS dashboard really would allow someone to have kind of bigger situational awareness and be able to figure out the best way to kind of pair the task tool, right? So again, something that is kind of in the back of my head, thinking through with multiple colleagues how this would look. Nothing has been actualized yet, but there are lots of different ways in which GIS can come to kind of improve the way we use and identify and deploy resources. So yes, super excited about it. Looking forward to moving forward with something like that.
All right. And so we have a lot of medical students tuning in on the chat, and they're wondering how they can stay connected to the field of research while they're pursuing their medical education.
That's always hard. That's always hard because the first goal of becoming a doctor is becoming a doctor. Usually for most people, and I think it should be. So I did several things when I was a medical student and a resident. I continued to have conversations with my mentors that were doing research in the humanitarian space, asking them what were possible needs that I could fulfill. Could I help them write up an introduction? How could I help them clean data? Could I help them just run a quick statistical analysis of something? When I was a med student, I engaged in a couple of different research opportunities. One was funded by the IDSA, where we looked to leverage the social capital of the church in Ethiopia to improve HIV/AIDS care uptake. That was a period of time in which the med school allowed me to take off. I believe it was in between, like during the summertime, to be able to go there and engage with folk in Ethiopia to do that. There are lots of those kind of micro opportunities that you can engage with without undermining your primary educational purpose, right? Same thing for residency. I had a block of time during residency that allowed me to actually go to Palestine and Israel and think through the medical refugee/transfer process there with people on the ground. I think one of the other components is just continuing to engage in conversations like these, right? Continue to have contacts, continuing to like build out your interest sets, and not over promising, because something that is a killer is when you say, oh, I can write this entire manuscript or do this entire like lit review, and then your immunology final comes up, or you're, you know, in the trenches in your surgery rotation and you just can't make it happen, right? So continue to engage, find those micro opportunities, continue to have conversations. In that space, you start to refine your interests a little bit more, and maybe you put out a poster, or maybe you put out an article with your mentor. Those things are phenomenal and will help move you forward. I mean, everybody here is probably deeply overaccomplished in type A anyway. But like even just those little tiny things will start moving you forward, and will continue to grow your contacts and your network as you're ready to step into kind of the more professional research field.
Thank you so much. So another question that came is as a physician and humanitarian actor, do you think there's any discrepancy between the clinical and the humanitarian field, or do these two fields, you know, just naturally always complement each other?
They're certainly both. Inevitably, I'm going to be the person that offers you the gray answer. So they are, medicine is always going to be a critical component to the humanitarian space. Medicine is not a panacea, and direct patient care is often not the thing that is needed, right? So if we start to scope out from medicine, as we're doing in the United States, like we're starting to think about public health and social determinants of health and environmental health and equity and all of the other sorts of things, sometimes those factors are much more important, right? So right now, I mean, in Ukraine, depending upon where you are, direct patient care is not the most important, right? It's not the most important or critical need. So if you move to the east of Ukraine, where there's like, you know, active trauma happening and people, you know, sequestering themselves in basements for weeks at a time, yes, of course. But if you're operating in the west of Ukraine, sometimes capacity building, training, those sorts of things are much more exigent. And there's some pushback from people who are like very primary, like patient care directed, in that they don't want to do that kind of work. And I think that's the problem, right? Medicine is not the panacea for every harm out there. Sometimes it's water and sanitation. Sometimes it's nutrition. And like I said, here in the States, we're starting to recognize that as well. But in the humanitarian space, it's much more obvious. So yes, complementary and also disparate. Health does not equate to medicine and vice versa.
So another question is, did you ever have any hesitations about the humanitarian sector and any possible hypocrisies, drawbacks, shortcomings, and how you worked through those, or adjusted your action in the humanitarian sector to deal with any moral ambiguities?
I'm only laughing because yes, all the time, always, every day. I don't even know where to start with this question because, I mean, the humanitarian sector, it started, you know, tens of 20s of years ago. You know, the humanitarian sector writ large really hinged on the idea of the cis white savior Western high income male coming in to save the populations, right? And that origin and that foundation in of itself has created a huge burden on the field and the industry to be able to rectify the way in which the entire humanitarian space engages, right? We're not talking like there are constant conversations right now about what does decolonization look like. There are huge conversations around what does localization look like, who do we involve, who identifies what the needs are, who has the right to self-representation, who's drawing the boundaries around communities, who, you know, is funding this work. How do we identify priorities of funding? How do we manage the relationships with funders versus the community members with which we are working? I mean, it is rife with ethical, problematic kind of moments all of the time. Why do I still continue to engage with it? Because if I wasn't, it would continue on without me. And I also don't have any interest in burning the entire structure down, because I think that there is a large number of people, more and more, who are actively engaged in the correct conversations. And I think that honestly, my being part of it and being perhaps a voice of dissent in certain spaces is important to change the thing. Yes. I could have that conversation for days. All
right. And then did you ever experience any, you know, turn downs or, you know, lose out on positions due to lack of academic or field experience, and how do you navigate those?
Yeah. So number one, I've certainly been turned down for lots of things. Hence my term tenacious, because you're going to get turned down for stuff unless you are a golden child who comes from a white privileged family. And even then, maybe. But the point is to, well, first order of business, the point is to recognize those as learning moments, right? If you can, reach out, ask why, ask what was the rubric that they made their decision based upon, and what were the pieces that you did not fulfill. Sometimes those are pieces that you're like, great, those are things I should be working on. Maybe I didn't interview well. Maybe I need 3 more publications. Like, those are things I want to work on. Maybe those pieces are things that you have no interest in engaging with. And then you can just say, okay, I'm going to move on from that piece. The field of humanitarian research does not look like an NIH research career. There are a few people in my sphere who are doing both, and they're phenomenal. But at the end of the day, humanitarian research does not churn and burn the same type of money or publications or prestige as many other research spaces do. And so back when I was looking for a faculty position after residency, I got that question a lot. Like, your grants don't look like our grants. Your publication list does not look like our publication list. You're not publishing in Cell. Like, there was a lot of trying to explain to somebody what my research was, why it qualified as research, and why it was still valuable if it didn't fit into the box of American medical research. Some people agreed, some people weren't convinced, but that's okay, right? Because at the end of the day, I want to land at an institution that gets it, or if they don't get it, they still respect and support me as a person. And I don't want to be in a space where I'm constantly being questioned for my value or the value that I bring to the community.
Great, thank you so much. I know that we are coming up to the end, and unfortunately we weren't able to get to all the questions. But Erica, would you be open to connecting separately with individuals who are interested in talking more about GIS and medical?
Yes, of course. Please feel free to give out my email. Feel free to get in touch with us get via LinkedIn, whatever version of connectivity. I will try to get in touch with you in a timely fashion. My inbox since Ukraine has been over 1,000, so I'm working on it.
All right, great. I am just trying to pull up your email to add it to the chat. But thank you so much, everyone, on behalf of the Harvard Humanitarian Initiative. Thank you all so much for tuning in. This event is a monthly webinar series that we host alongside a whole nother humanitarian focused events. Follow us on our website, Twitter, LinkedIn, YouTube. We'll be posting a recording of this on our website and on our YouTube account. And also head to our website to find any new job openings. So with that, and I see that you put it in the chat. Thank you so much. Thank you so much, everyone, for tuning in. And I hope you have a great rest of your day.
Thanks, everyone.
Oops, I realized. All right, there is Dr. Nelson's email. All right, have a great rest of your day, everyone. Bye.